Good afternoon. I'm Mark Fox, the Deputy Health Officer for the St. Joseph County Department of Health. Thanks for joining us for an update on COVID-19 in St. Joseph County. I'm joined today by Mayor Mueller and Jeff Ray from the COVID response. I'll begin with a little summary of current data for St. Joseph County. We currently have 363 confirmed cases of COVID-19 among residents of St. Joseph County. There have been 33 of those patients have been admitted to the hospital. As reported yesterday, we've had 7 deaths among St. Joseph County residents. We currently have 23 confirmed cases of COVID-19 in St. Joseph County hospitals. Those are not all St. Joseph County residents, however, but 23 cases in the hospital and another 25 patients under investigation in St. Joseph County hospitals. Of the St. Joseph County residents admitted to the hospital, St. Joseph County residents diagnosed with COVID-19, slight majority of them are female, 56.5%, 43.5% male. This is the age distribution. Again, we continue to see a trend of preponderance of people under age 50. So there are 62% of confirmed cases of COVID-19 are in patients under age 50. This is the race and ethnicity. Slight majority of confirmed cases are in whites. You'll see this week that African Americans still represent about 12% of confirmed cases. The proportion of confirmed cases who are Hispanic has grown to 20% of our current data. We're still missing data on 12% of cases identified in the county. This slide reflects the hospitalized cases, so a slight preponderance of males among those patients, among St. Joseph County residents who have required hospitalization. This is the age distribution. You'll see 71% of hospital admissions have been in patients age 60 and older. Race and ethnicity, 40% of hospital admissions have been white. Almost 22% of hospital admissions are African American. Again, among confirmed cases, they're 12%, so they're overrepresented. Hispanic, 18.8% of hospitalized patients are Hispanic, about mirroring their representation among confirmed cases. This slide shows the growth in confirmed cases, the orange bars over time. The trend continues to not be as steep as it had been at the greatest trend in our community. So I still believe we're seeing benefit from the stay-at-home orders and travel advisory and attention to physical distancing. Obviously, with the outbreak in a long-term care facility this week and with increased access to testing, we have seen continued increase in cases. Our doubling time, though, has increased from around 5 days as of a week ago to just under 7 days at this point. So while the curve isn't flat, it is improved, and that's reflected here in this slide. Again, this is St. Joseph County data superimposed on another national data set. So the blue line at the bottom of the graph represents St. Joseph County, and this is the number of days since the 20th case, which is the standard that's been applied on these other lines represented on this graph. So our trajectory is better than what we've seen for the state as a whole, and while not flat, certainly is not as steep as it was. Just a couple of quick comments about testing in the county. So to date, there have been about 5,200 tests performed in St. Joseph County. That's almost doubled from a week ago. And we're currently testing about 400 individuals a day in St. Joseph County. So the clinical systems have dramatically increased their capacity, particularly in the last week. We've also had increased access on the west side with a fixed location at the Sister Mara Brannock Clinic and another site at the St. Joseph Physicians Network location northwest. And then the introduction of a mobile unit sponsored by Beacon Medical Group that today has been at the Goodwill location out on Western Avenue in an effort to increase access to testing on the west side of the county. So we have seen a definite increase in testing capacity. We've also seen, continued increase in hospitalization and death, and certainly with the introduction of an outbreak in a long-term care facility that is concerning, as well as the outbreak in a correctional facility in a neighboring county, which could ultimately have an impact on our local healthcare infrastructure. But I'll conclude there and turn it over to Mayor Mueller.
Thank you, Dr. Fox. This morning, we held a emergency business assistance fair and had well over 130 people join the virtual conference to get help from financial institutions so they could share what products they're offering and how they're implementing the federal relief package that was passed a couple weeks ago, as well as a partnership that the City of South Bend and 2 CDFIs have initiated in terms of additional assistance for small businesses. And we're starting to hear a lot more talk about reopening the economy. And you hear it from the national level, the president. We heard yesterday from the governor that there are some thoughts that Indiana may begin to reopen in mid-May. But we need to be careful. We can start to see the light at the end of the tunnel, but we still have no idea how far we are from the end of the tunnel. And so, we're encouraged by the numbers where the curve that Dr. Fox just showed is flattening, but we still have these are some of the most intense days yet, and we still may be climbing. And so our best guess is our peak may hit a little later than the Indianapolis area, so that may put us into the middle of May. And once we get to the peak, that's kind of the halfway point, or maybe a little past the halfway point, but we'll still have a period of time after the peak before we're able to reopen, and certainly before we fully reopen. And so there's a lot of talk, and rightly so. We want to be hopeful that we can open sooner rather than later, but there is still a ways to go, and that light is tempting, but we've got to make it all the way through the tunnel first. And so that's where we are. And then in terms of when we do reopen, it's not going to happen all at once. And if certainly the things that closed first will be the last to reopen. So whether you're thinking about long-term healthcare facilities or those vulnerable populations, large events, I know some sporting seasons in the fall haven't been canceled yet, but we've got to be weary about whether that's going to be possible this year, and those announcements will come in the coming weeks and months. But just know this will be a slow process to open, and we may, if we get ahead of ourselves, we may be forced to bring back additional measures. So the important part is getting this right this time, making sure we get it under control, and don't reopen too fast so that it gets away from us, and then we have a big problem on our hands. And with that, I'll turn it over to Jeff Ray, who's been leading a lot of some of the coordination pieces of various items to prepare for the surge, and also to make sure that we're ready to go when we do reopen.
Yep. Actually, I'm going to defer to Commissioner Costelli first, so
okay,
we'll go that direction. Sorry.
Thank you, Jeff. A couple of things I'd like to touch on today are from a voting standpoint. I know that they made some announcements yesterday related to that. So there is, right now, the June 2nd primary is still taking place. They're encouraging everyone to vote by mail, so it's now a no excuse vote by mail absentee ballot proposition. So simply call voter registrations and they can get you a ballot mailed out to your house. There will also be in-person absentee balloting, their voting, and that will be mostly likely the county city building and the city services building in Mishawaka. I believe that's going to begin on May 26th, which is the day after Memorial Day, and end on Saturday the 30th, the Saturday before the June 2nd election. And there will be in-person voting on June 2nd. I know the election board are still trying to work through that. We have gone to a vote center in St. Joseph County, so there will be at least 10 polling locations open, but every citizen will be able to vote at every polling location, regardless of where it is or where they live, will be new this year. To also talk about join in with what Mayor Mueller on the local economy. I mean, we're talking every day with local businesses about what things they may or may not be needing when we reopen. And keep in mind, this is going to be more garden hose than fire hose. So it's going to be, we kind of gradually shut things down. We're going to hopefully gradually reopen them. But please, wherever you can, support your local businesses because they're always here to support us. So whether that is from restaurants, if you carry out or get things delivered, if you have an opportunity to buy gift cards from different locations, because to help them, you're going to go back there when things open back up, but hopefully from a cash flow to get them some money now so they can help stay open, because we want to do everything we can to help support our local businesses. I know the county, depending upon what the governor does at his press conference later today, the county is exploring the possibility of keeping their limited closure through Monday, May 4th. Once again, it depends on what the governor does. As Mayor Mueller said, we're not out of the woods yet. I mean, in many cases, we're just approaching the peak. So we want to make sure that we continue to do things as responsibly as possible. And to that end, I mean, we remain in constant contact. We had a meeting this morning with Roseland officials and Clay Township officials. I mean, how do we properly and effectively coordinate the actions that we're taking to make sure we do so in a responsible manner to help support those people, citizens that need our help the most. I think we've done a fantastic job here in St. Joseph County in partnership with other state agencies, particularly with the coordination between the city of South Bend, the health department, the county, Jeff Ray's help too. We have really done a fantastic job, and I think folks from around the state are looking at how we're operating here in St. Joe County. So I appreciate everyone's efforts as we move forward. Thank you.
Great. Thank you, Commissioner. Really appreciate your kind words there. So I want to touch on just a couple of things. I think, from day one, all of us have been laser focused on protecting the health and safety of all of our citizens. And so these gentlemen here to my left, Commissioner Castelny, all our first responders, our healthcare providers are all, share really a common goal in terms of how do we make sure people are safe and healthy throughout this. And so I happened to be on a call this morning with state officials who again complimented the great effort that's happening in St. Joseph County. Some of this organization isn't happening in every part of the area, and they're very complimentary of us, in particular, just how everybody's working so well together, and we appreciate that. I think that state perspective is really important. Obviously, the mayor and Mark Fox talked a little bit about the coming weeks and the coming months and the expectation of a surge and what that means. As a local community, we our hospital systems and the community itself continue to plan for what that might look like and to be ready for whatever comes. As we've looked around the country, we've seen quite a few actions taken to be ready for that, and I'm confident that both here locally in partnership with the state of Indiana that we're prepared should we experience a surge, and we're ready to handle that. A couple of our speakers mentioned the restarting of the economy, and I think that's on top top of mind to so many folks. Unemployment numbers continue to be really high, and businesses, we're hearing about some of the business assistance programs starting to run out of money. A big step this morning by the city to try to bring some resources together. Mayor, thank you for leading the effort to bring some additional assistance to businesses. There currently is a lot of conversation in the business community right now about best practices, the playbook, what's it look like when I reopen, and so a number of different survey activities happening right now to make sure that businesses have what they need should we open, with the idea of how do we continue to limit the spread. I think both of our speakers mentioned be careful on the restart, and it's interesting. I'm not a student of health, but I happened to sit in a presentation earlier this week where we were talking a little bit about the pandemic of 1918 and how communities reacted to that, and how some of them came out of it maybe a little bit too quick and ended up and had a second spike. And I think the mayor cautioned we need to make sure we're careful on the decisions that we make right now as we're coming out of this action to make sure that we don't have a second spike later on down the road. And obviously that's a goal of all of us, and that's why we're continuing to that laser focus on the public health and safety of all our folks, and making sure that we separate folks that need to be separated, that we continue to do isolation, and that we do all the little things that are be helpful. My mom has been sitting at her dining room table, making masks for folks, and so it's little things like this that are going to make a big difference to folks. So obviously, as you're out in the grocery store, you see more and more folks wear them, but things like that are really helpful to our community, especially here in the short term. And I have a lot of confidence in the leadership. These gentlemen are working tirelessly around the clock on behalf of the community. I'm amazed sometimes. I give them both all three of them a hard time about the times of days that they send me emails and respond to different things. But this is a 24/7 activity here, and it's all hands on deck, really being prepared for it. And as a community, we should have a lot of confidence in that good work that's happening. And although we don't know what the weeks ahead present, we're ready to handle them, and we should have a lot of confidence in that. So with that, I think that's the end of just some prepared remarks, and we would go to some questions. And Caleb, I'll turn that over to you.
All right, so our format is going to be the same as it has been in past weeks. I'll run down the list of our media guests, and please unmute yourselves, and then let us know who you're directing your question towards, and then go ahead and ask your questions. So we'll start at the top of the list that I'm seeing here with ABC 57. And if you go ahead and unmute yourself, we should be able to hear you. Okay, we'll move to Anna Caroline Caruso with WVPE.
Hi, this is for Mark Fox. From a health perspective, can you talk about if you think it's a good idea to start reopening, or when it might be safe to start reopening parts of the economy?
Yeah, so as I've said before, I think there are models that exist to support whatever conclusion an individual wants to draw. So one of the national models that suggests that the peak for the state of Indiana was actually last weekend. That's driven largely by the population center in and around Indianapolis, and there are certainly some encouraging trends in Indianapolis with respect to the number of new cases and hospital discharges and things. That doesn't reflect our reality here in the north central part of the state, and so some more specific modeling for our area, as the mayor suggested, suggests that the peak for our region is going to be early to middle part of May. And so, I think even for the state as a whole, and certainly for our region, it's too early to even begin contemplating until we get to a place where we have decreasing number of infections over a sustained period of time. If we attempt to reopen too soon, we'll just have this stuttering effect of opening and closing and opening and closing. I still feel like we're fairly early in this process, even though for everyone at home, it feels like it's been going on for quite a while. My wife and daughters are climbing the walls, as many people are. So we recognize that reality, but it's really important, and we have seen some benefits of that. But our peak is likely still several weeks away.
Okay, that's all I have. Thank you.
We'll go to Brian Coney Bear. Brian, if you want to unmute yourself, you can go ahead. Okay, we'll move on to DJ Manu from WSBT.
My first question is for Dr. Fox. You were saying that we are now seeing more testing and doubling what we saw last week, including those beacon sites where we can now access more people that were not able to get tested before. Can you speak about how having this more readily available testing for other people that maybe weren't before, how that will help us determine when it is safe to reopen and what our real numbers look like in our county?
Yeah, so your audio was cutting in and out there a little bit, but as I think I heard the question is this increased access to testing, what implication does that have for prospects of reopening, and what does it reflect about what's really going on in our community? So, from the Department of Health's perspective, there are a number of things that are really necessary in order for us to safely fully re-engage, I guess. So one is there needs to be access to testing, widespread access to testing that is a rapid test format, just like for strep throat or flu, where you could go to your provider and get tested and have an answer in 15 minutes. Along with that, there has to be good surveillance, data surveillance, and continued contact tracing. So currently, our public health nurses are continuing to do contact tracing on every positive case. We will continue that, but if we do hit surge here in a few weeks, our capacity will be overwhelmed, but also that process of contact tracing will cease to be informative. If there's widespread community transmission, which I wouldn't say we have widespread community transmission at this point, but if and when there is, then contact tracing is less informative in terms of the appropriate strategic response. As we come out of whatever our peak is and things go back towards some baseline and we begin to reopen the economy more broadly, we'll need to have access to testing, and we'll have to resume regular contact tracing and be very effective in identifying clusters and pursue isolation aggressively in order to avoid that stuttering effect of opening and closing repeatedly. So I think, access to testing is going to be critical. The ongoing contact tracing is going to be critical. Having adequate hospital capacity, both with respect to personal protective equipment and hospital beds, is going to be key. Right now we have hospital capacity because we aren't doing elective procedures. It would be ill-advised for the health of the community for that to continue indefinitely. At some point we need to get back to ensuring that people have appropriate access to diagnostic tests and surgical interventions and things like that. So in the short term, the suspension of elective procedures is important, but for both the economic life of the community and the health of the community, those things need to be restored at some point. We still need the additional hospital capacity to deal with new infections and new hospitalizations from COVID in the midst of that. And then ultimately, for the economy fully to be restored, we need access to effective therapeutic interventions as well as a vaccine. And obviously a vaccine is still quite a ways off, so I'm not saying that we have to be on hold until that time, but those are really the critical elements that we see that will assure us the safety of fully re-engaging. I think until we have effective therapy or a vaccine, some degree of physical distancing is going to become part of, our cultural norm until that time.
I guess the intent of that question is more along the line of, now that we have this extra texting option, how is this going to help prove what we really are seeing in our community?
I don't know at what point we'll have a really good estimate of the true prevalence in our community. To some extent, the hospitalizations are the most objective measure of the impact of the disease in our community, but clearly we know certainly of many families where one individual was symptomatic, got tested, other individuals in the family had similar symptoms but didn't get tested, but we presume that they were all positive. Those presumed positives aren't reflected in our numbers. All our numbers truly are laboratory confirmed positives. So clearly there are more people in our community that have been infected with COVID-19 that aren't reflected in these numbers. So, increased access to testing does give us a better sense of the prevalence in our community, but to this point it certainly has not been representative of our population as a whole. So it's difficult still to draw any firm conclusions on the proportion of our community that's been infected to this point.
All right, thank you. My question, it didn't make a difference if it was Mayor or Jeff, whichever one could best answer this. Regarding any conversations you had with Governor Holcomb about as he's deciding what we're going to do going forward with the reopening, what they're looking at and the conversations you're having with them in regards to St. Joseph County.
I think it's, I'll let Jeff speak too in a minute, but I think it's pretty clear that Governor Holcomb is data-driven, so he's looking at the numbers. And that, again, the best real-time data that we have is what are the hospitalization rates across our state. But also, as the testing ramps up, that helps get a new source of information as well. So he's going to be looking at data, and I think he's been pretty clear on that, and that's good for the health of our state and our city.
I think the data is a key piece, and I think he's also looking at the practices that businesses are putting in place. So this week in particular, the conversation about those playbooks. What are the practices that people are putting in place in order to reopen? So there's a sort of an active, I would call it, data gathering spot right now where he's seeking that information from businesses. As a region, we're working to collect that, get that back to the state to help advise on that issue. And then I think he's also hopeful that some best practices get shared across different platforms. So some manufacturers have done a really good job of making sure that the workplace is safe and that practices are there to give employees some comfort that they could come back to work. Others haven't been as forward thinking as that, and so how do we make sure that as these places open, these practices are in place? So again, we minimize the spread and keep people healthy. So this is important, but I think as the mayor mentioned, he's really dialed into, we've got to do this at the right time so that we don't have to do this several times.
Thank you.
We'll go to Jeff Parrott with the South Bend Tribune.
Yeah, my question's kind of two parts for Dr. Fox. Dr. Fox, can you explain why you project our numbers here in the South Bend region to peak a couple weeks after what they're calling for at the state level?
Yeah, I think there are several factors that come into play. If you go back to the very first cases in the country and in communities across the country and in our community, they were largely related to travel exposure. And so communities that had especially the biggest proportion of international travel were impacted most heavily and earliest. by and large. And so the fact that we have, less international travel than is seen in Indianapolis is one factor. But then also looking at the doubling rates is another factor that comes into play into these models, and the number of hospitalized patients. So, the models take into account a number of different factors, but it's largely because there were, for the same point in time a month ago, we had fewer cases than Indianapolis, but our trajectories, were looking very similar. We likely see the benefit of all the mitigation strategies, the work at home and the travel advisory and, closing of businesses and things. So because we were behind Indianapolis in terms of the number of cases at the time those measures were put into place, we will realize more benefit from those, and that's likely why our curve is a bit flatter. But so there are a number of assumptions that go into the modeling, but those are some of the factors that it's based on.
So if we're going to peak a couple of weeks after the Indianapolis area does that mean that you're also going to recommend that we reopen our economy up here a little bit after, like Governor Holcomb calls for doing so statewide?
Well, I am hopeful that the governor will take into account the state as a whole, and not simply the Indianapolis metro area, and thinking about when is the best time to really reopen things. So, again, our proximity to Chicago also is a factor in how our community is impacted. So, the governor hasn't asked my opinion, but I am hopeful that he's certainly going to think about, all corners of the state and what makes the most sense.
And this finally, Dr. Fox, the sound quality was very poor at the beginning of this, so I didn't catch some of your first remarks. I wonder if you could go over some of the numbers that you were saying earlier. I think I heard that maybe 5,200 people have been tested in the county. That's all I heard, though.
Yeah, so I went through the slide deck, which will be made available. The comments about testing are not reflected in the slides, but there have been 5,200 tests done in the county by our count. So that's a significant increase from where we were a week ago. And currently there are somewhere north of about 400 tests per day being done across the county. So again, that represents a significant increase in capacity. One thing that I alluded to, I think, at the outset of the slide deck and then never actually talked about was there have been some questions about how many people have recovered. So we've talked about number of cases identified. We've talked about number of hospitalizations and death. But also, today I can say that more than 50 people have been declared recovered from COVID-19 in our community. Again, most of those are from the first several weeks. You think about the number of cases that have accumulated here even just over the last week, where we've essentially doubled. So we are, now confirming that a number of people have recovered. I think that 50 is probably a low estimate. Those are ones that I have confirmed have recovered. So we're still working on trying to gather the data from the follow-up that's been done by our public health nurses. But it's encouraging to see evidence of that.
Thank you.
Okay, we'll go to Lindsay Stone with WNDU.
WNDU. Each of my questions have been asked and answered, so I don't have any more, but thank you to each of you for all the work you're doing. We appreciate you.
Thanks, Lindsay. And we'll circle back to ABC 57, if there were any questions from ABC 57. Okay, with that, I think unless there are any additional questions, we'll do one quick round. If there are, go ahead and unmute yourselves and let us know. Seeing no additional questions, we will conclude the press conference. You can find a archived version of the video on the City of South Bend website, southbendin.gov. It'll be posted on the website right now, and you'll also be able to find a copy of the PowerPoint presentation presented by Dr. Mark Fox there, and we'll additionally, I think, get a version of that up on the County Health Department website too. Thanks for joining.
Thank you, guys.